Hello everybody and welcome to this edition of Virtual Coffee with an OSCE Educator. My name is Sarah Gran. I'm the Managing Director of My Healthcare Recruit and the owner of OSCE Accelerator. We are joined today by the lovely Beth Vincato. Beth is one of our OSCE Accelerator advisors. She has been teaching the OSCE at an NHS trust for over 5 years now. She has literally helped thousands of nurses through the OSCE test. So we're delighted to have her with us. We get lots of questions on our social media about the OSCE test, and today we really wanted to do a bit of a deeper dive into the IB flush and the VIP score. So welcome, Beth. Thank you for joining us.
Hello and welcome everyone.
Thanks so much. And I think let's just dive in straight away, Beth. Can you tell us what this station is about? If someone's new to the IV flush station, what can they expect at this station?
Okay, so obviously for this station you're going to have to give an IV flush. It's just like the flush we give before we give any medications IV. You also have to assess the cannula prior to giving the flush, and you have a prescription for the flush itself.
Got you. And how long does the station last?
So it's 12 minutes.
12 minutes, okay. Feels like a long time. I know it passes quickly. Is there any documentation required for this station?
So you'll be given a drug chart with your flush. You'll also be given a copy of this VIP score. Mm-hmm. But you don't need to document the VIP score. It's just like for reference.
Got you. And so what kind of equipment might someone come across at this station and be expected to interact with?
Okay, so obviously you're going to have a mannequin with your cannula in, which you can actually flush. Also, they might give you a photo of an arm or a hand with a cannula in for you to conduct the assessment. The flush itself will be given to you in a pre-filled syringe, so you don't need to prepare that. That will save you a little bit of time.
Wonderful. Can you tell me a little bit more about this VIP score then and what's required in that respect?
Yeah, so if you haven't come across it before, I would recommend looking it up, but don't spend too much time on it. It's not really so important as some of the other things for your exam. So it stands for Visual Infusion Phlebitis Score, and it's a scoring system which should be used to assess cannulas and their risk for phlebitis.
It's a funny one, that one, isn't it? A mouthful. Phlebitis.
Yeah. It also gives you some advice on what to do if your cannula looks infected, like when to stop using it, when to recite it. So for the exam, you don't have to use this one. You need to, what they require you to do is look at the cannula and tell them what you're looking for. So according to the marking criteria, you should be looking for pain, erythema, edema, palpable venous cord, and pyrexia. So just have a look at your cannula and make comments about these things. Obviously the cannula will be okay because you're going to have to use it.
And would you be expected to give a VIP score or just comment on how it's presenting?
No, you're not expected to give a score. This isn't part of the marking criteria. So that's why I say don't worry too much about learning it as long as you're aware of what it is. And
commenting on those symptoms. And is there a certain number of symptoms that you need to comment on to be within the marking criteria?
I think on the marking criteria it's 2 or 3. But I would just advise just to try and learn all of them, because in the exam you're going to be stressed and quite often people miss things, so just try and learn them all.
Sure, no, that makes sense. So how would you recommend that a learner best prepared for this station?
So make sure you're familiar with the cannulas we use here. Often you'll have to use an extension set attached to this or an octopus. I found talking to a lot of nurses, they're pretty much the same as the cannulas they use in their home countries. Obviously, there's some variations, but just make sure you know what it looks like. You don't want the first time to be seeing it in your exam.
No, that makes complete sense. Any particular reasons for common fails or common mistakes at this station?
Okay. So not checking your expiry date. So remember, in the OSCE, we have to do this for all of our items and verbalise it to the examiner. Not using non-touch techniques, so touching the end of the port or the syringe. Also not explaining the assessment properly of the cannula site, so what we've just discussed.
Got you, that makes sense. So to round up the IV flush and VIP station then, any top tips for international nurses who are presented with this? Anything that you'd give away wisdom wise?
Okay, so I would say practice as much as you can. If you can, get a colleague who's taking the exam to practice with you. If not, a friend or someone. Get the marking criteria and use that when you're practicing, and also time yourselves.
Very important, the timing.
Good luck.
Wonderful. Well, thank you so much for your top tips, Beth. Much appreciated. And we look forward to you joining us again next time.
Okay, thank you. Bye.
Thank you.